So if you're one of those people, anytime they have fever, they will always say it's just fever. Fevers are serious. It's just common malaria or flu. They might want to have a rethink. Now, the reason I'm saying this is because Lassa fever is also a fever, right? But it's highly dangerous and kills quite a large amount of people. Now, the scary part about this is that by the time you really start to feel sick, then time most likely would have already been fast spent. Now, if you live in the rural areas near the markets, in hostels, or basically anywhere that rats are free to roam about, you see rats roaming about freely, then this message is for you. Now, Lassa fever usually begins with that mild fever, headache, you're feeling weak, dizzy, or you're vomiting, obviously they start vomiting or they are nauseous. Now, these are symptoms usually that you see in malaria, right? So most people at this point, they will just say, oh, it's malaria, or I'm stressed, so let me get anti-malaria drugs, and they start taking anti-malaria drugs. But guess what? As you're taking your anti-malaria drug, or while you're taking your anti-malaria, the virus itself is multiplying rapidly, and by the time you know it, the illness or damage to different organs have already begun. Now, I see quite a number of patients, especially when it comes to things like Lassa fever, coming late. Now, this was because somebody out there thought it was malaria and told them to buy anti-malaria drugs, and they started taking anti-malaria drugs. By the time they realized this patient is not doing well, already bleeding from different parts of their body, now they are bringing the patient to the hospital. So Lassa fever usually is caused by the Lassa virus, caused by a virus which is known as the Lassa virus. Now, this virus is usually transmitted, or usually would get this virus when you come in contact with a surface that has been contaminated either by rat droppings, that's your feces now, or urine. So if you're touching a surface that has been contaminated, or you're eating food that has been contaminated, or even just by caring for someone that has the Lassa virus without actually not protecting yourself, wearing protective equipment, then you too can get that virus. Now, like we said, some of the things usually which people would notice at the initial phase, because we said at the beginning that most of the symptoms early phase usually would mimic malaria. So most of the things that at the beginning this person you notice that maybe you're having like slight headache, you're having a fever, body ache, you're feeling nauseous, you're vomiting. And this is it's at this point that most people usually will miss it, because most people at this point will just assume that this person is having malaria. So what do? I go to the pharmacy and I get an anti-malaria medication, and then proper treatment is actually not going for this patient. So by the time the disease is left to progress, or the viruses are left to multiply, the patient now begins to have multi-organ damage. So they now have things like bleeding from their ears, their nose, their mouth, their gum. A lot of people start having confusions, they feel dizzy. Some people can even start having seizures, and in worst case scenarios, it could lead to death. So if you're noticing even one of these symptoms, don't just write it off and say it's just malaria. What if it's not malaria? What if it's Lassa? So if you're having any of the symptoms, go to the hospital. Don't wait. Let your doctor check and examine you properly, and now initiate the appropriate treatment that you actually need. And also work out some of the things that we can do to protect ourselves and our loved ones from it. Some of these things will include storing our grains or uncooked food in containers that have appropriate covers. I'm very specific. Appropriate covers that usually will be very tight when you cover it. You want to ensure that your surfaces, usually you clean it, you touch tables, things that usually will frequently touch. You ensure that you clean them at intervals. You want to ensure your environment is clean. And then for places that usually or things that usually would encourage rat infestation or rat to multiply, you want to ensure that your surroundings are clean. You don't have scattered cupboards, scattered containers here and there that would now encourage rats to multiply. And if, for instance, you're having a loved one that is ill, even if you don't know the nature of the illness and you're caring for this person, ensure that you're always protecting yourself by wearing gloves for that. So if this is the first time of you coming across my video, like, share, subscribe.